Are you paying too much for your Medicare plan without even knowing it? Or maybe you think your coverage is fine, but there's a real chance you are in the wrong Medicare plan right now. This happens to millions of seniors every year. Medicare is confusing. There are many plans, many rules, and many companies. One small mistake can cost you hundreds or even thousands of dollars each year. The sad part is, most people do not realize it until they get a big medical bill. In this video, I will show you how to know if your Medicare plan is right or wrong for you. We will talk about Medicare Advantage, Medigap, Plan G, and Plan N. I will also show you how to check your plan in a simple way. By the end of this video, you will know how to protect your money, get better coverage, and feel more confident about your Medicare plan in 2026 and beyond. Why so many seniors are in the wrong plan? Choosing a Medicare plan is not easy. Even smart and careful people get it wrong. One big reason is confusion between Medicare Advantage and Medigap. These two types of plans work very differently, but many people think they are the same. Another reason is marketing. Many insurance agents and TV ads talk about the best plan without explaining what that really means for you. Some agents earn more money by selling certain plans, so they may push those plans even if they are not the best choice for your situation. Also, Medicare changes every year. Prices go up, benefits change, doctors leave networks. A plan that was great last year may not be good this year. And finally, many seniors do nothing because they're afraid to change. They think switching plans is hard or risky, so they stay in a bad plan and keep paying more. Signs you may be in the wrong Medicare plan. Let's talk about some warning signs. One big sign is high out-of-pocket costs. If you are paying a lot for doctor visits, hospital stays, or prescriptions, your plan may not be covering what it should. Another sign is limited doctors. If you are on a plan that doesn't let you see your favorite doctors or go to the hospital you want, that's a big problem. Confusing bills are also a warning. If you keep getting bills you do not understand or you see mistakes, your plan may be poorly managed. Sometimes friends and family have better coverage. If people with similar health needs are paying less and getting more, it is time to look at your plan. And remember, plans change every year. If you haven't reviewed your plan in a long time, it may no longer fit your needs. Medicare Advantage versus Medigap explained simply. Now let's explain the two main types of Medicare plans. Medicare Advantage plans are offered by private insurance companies. They often include extra benefits like dental, vision, and sometimes gym memberships. But these plans use networks. That means you can only see certain doctors and go to certain hospitals. If you go outside the network, you may pay much more. Medigap, also called Medicare Supplement, works with Original Medicare. It helps pay the costs that Medicare does not pay, like deductibles and coinsurance. With Medigap, you can usually see any doctor in the United States that accepts Medicare. Medigap gives more freedom and fewer surprise bills. Medicare Advantage can be cheaper each month, but may cost more when you actually need care. Plan G versus Plan N. If you choose Medigap, two popular plans are Plan G and Plan N. Plan G has a higher monthly premium, but it covers almost all medical costs. You usually only pay the Part B deductible. This means fewer surprises and more peace of mind. Plan N has a lower monthly premium, but you pay small copays for doctor visits and emergency room visits. It's good for people who are healthy and don't go to the doctor very often. Neither plan is better for everyone. It depends on how often you use healthcare and how much risk you are comfortable with. How to check if your plan is right. Here's a simple way to review your Medicare plan. First, look at your medical bills from the past year. How much did you really spend? Next, check if your doctors and hospitals are still in your plan's network. Then compare your premium, copays, and deductibles with other plans in your area. You can do this on Medicare.gov.
Also look for hidden costs, especially for prescriptions and hospital care. Finally, talk to a licensed Medicare agent. A good agent can show you better options without pressure. What to do if your plan is wrong? If you find out your plan is not right, do not panic. You can change plans during open enrollment from October 15th to December 7th. Some people also qualify for special enrollment periods if they move or lose other coverage. The key is to act. Waiting can cost you money and limit your choices. Final thoughts. Choosing the wrong Medicare plan can cost you a lot of money and stress, but you don't have to stay stuck. Review your plan, compare your options, get help if you need it. Subscribe to this channel for more Medicare tips and updates for 2026. Make sure your Medicare plan works for you, not against you.